The AMA was pleased that its efforts in terms of advocating for vulnerable patients, carving out those concession card holders and under 16s from the co-payment proposal was successful. But what we are not pleased about are some of the other measures that have been introduced as part of this proposal without any consultation with the profession. Over the past week, the AMA went out to its members and asked our GPs what they thought of the new co-payment proposal, and what we received back were some of the angriest emails that the AMA has received over any issue in a long time. There are three elements that have angered GPs. First of all is the rebate cut. We know that for non-concession patients over 16 there will be a rebate cut of $5 and GPs will be able to charge that $5 directly to the patient. Again, this is taking money directly away from general practice. It means that there are more costs for patients going to see the GP. The second issue is the rebate freeze. Now, the rebate freeze applies not only to general practice but of course to specialists. It is a rebate freeze over the next 4 years. We've already had rebate freezes over the past almost 2 years, and for the viability of any general practice but any small business to have a freeze of that duration and expect people not to be able to have to pass on those costs to their patients is certainly inconceivable. So it is absurd that we have a situation where we have a freeze in rebates and we're not being expected to pass those costs on directly to patients. Now that affects, of course, not only the non-concession group but also the concession group. And over time, as the rebate no longer reflects either the cost or the value of the service provided by general practice but also specialists, it is only going to be the case that people are going to have to pay more out of their own pocket. The third aspect of the co-payment proposal is perhaps the one that's angered our GPs the most, and that is the change in terms of the Level A and Level B rebates. So previously the differentiation has been on complexity. The government has now said that they will change the regulations such that consultations taking less than 10 minutes will be Level A consultations. Now, as many experienced GPs have said to the AMA, those experienced GPs that are efficient, that can actually diagnose a problem by examining the patient and taking a history and prescribing a management plan and explaining that to the patient, that can be done for many patients in 8 or 9 minutes. We had an example only yesterday provided to us of a young woman with a breast lump who could have a history taken, an examination, a management plan, referrals for the appropriate tests, and also an explanation as to why that GP felt that it was a benign lump but why it needed to be investigated, and that can be done with 8 or 9 minutes. Now, why that consultation, that quality care, should be worth only $11 now compared to the $37 that it was worth last week is certainly not something that the AMA supports, and we will be lobbying hard to make sure that that change is disallowed in the Senate.